Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to discuss teeth. So, do you grind your teeth? Does your jaw hurt in the morning? Or do you feel like the lower part of your face is just a little bit wider than you prefer? Maybe you want a little bit more angular definition here. We're going to talk about treatments for that today. So this is also known as things like Masseter Botox, TMJ Botox, teeth grinding Botox, whatever. And remember, I'm only using the term Botox as the generic term, not the brand name. But what can we do for this? So first interesting fact is the bite force, or the force that your jaw physically experiences when you're chewing, is actually the strongest force that any bone experiences in your entire body. I want you to think about that for a second. This is due to evolution, and because of that, the muscles of chewing, in the medical term is called mastication, the muscles of chewing are extremely powerful muscles. Unfortunately, this does mean that sometimes they can get a little bit big and sometimes be too strong, too overpowering, and they can cause pain. So I actually am someone who experiences this. For me, I tend to feel kind of pain and tightness right around this area, especially when I wake up in the morning, because I clearly must do this at nighttime. Other issues that you can get with it too are headaches. Your teeth might actually get ground down to the point that you need to get fillings and other special treatments for it. So the question is, how can we treat this? Very simply. There are two main muscles that are involved with the muscles of chewing, and they are both very big muscles. The first one is the temporalis muscle, which lives right around here. That's the part that if you stick your fingers here and you bite down, it'll pop out a little bit. And then the biggest one is the masseter muscle, which lives right around here. So if you bite down, it will pop out. Now mine are not popping out too much right now because mine are treated currently, but it's a very big muscle band that sits right here. So what we tend to do in this practice is we will inject a botulinum toxin of choice into the masseter muscle to decrease its activity. Now, like I said, this is an extremely strong muscle. So the number of units involved to get this muscle activity to calm down is usually a lot more than you would think. So I'm just gonna throw out some numbers here. If you usually get maybe like 20 some units to cover your entire forehead, maybe around your eyes, we're talking something like at least 20 and 20 just to start with on each side. This is a very strong muscle, so you do need to use more units in order to get the actual effect of it. Now, the second thing to know about it is that it does not, because of how strong the muscle is, it does not fully paralyze the muscle, so it should not impact your ability to eat, talk, do anything like that. The way I tend to notice that it works is that I just cannot physically clench as hard or hold it as long. So you still are able to bite, which is good, but it just won't be quite as strong or quite as powerful. Now, I've been mainly focusing on the masseter because it is the strongest one that we use. And this is also the nice benefit of getting masseter Botox is it can help slim your face here, because if you have really big, powerful masseter muscles right here, you can see how that can kind of square out your jaw. So a lot of patients will also seek out masseter treatment just to slim their jaw a little bit. Things to know about the injection of the masseter muscle is we do inject right around here down at the bottom. You'll see in this handy dandy video of Dr. Ruff injecting here that we follow along here. This is where the muscle is. Now, technically the muscle does travel up this way, and some patients will ask me, well, my pain is up here, why are you not injecting up here? The reason is as it travels up this way, you start running into some muscles of smiling, and you definitely do not want to hit those muscles. So that's why we focus just down here where it's largely just the masseter muscle. Now, other patients will say, wow, we have already been doing like 50 units in each masseter and I'm still having problems. This is when we'll start to introduce injections to the other muscles, such as the temporalis I discussed. You also have a few inside the mouth that we'll inject. Those are usually a little bit more advanced and not as commonly sought out because usually the masseter Botox is effective enough in and of itself. But those are some options for you to consider if you feel like you still are getting too many problems with just the masseter Botox on its own. Unfortunately, as helpful as this treatment is, it is not always covered by insurance, although it is something you can try to do, but it is not currently recognized as a type of treatment that most insurance companies cover. One last thing is you do want to make sure that you talk to your dentist or an oral surgeon as well about these issues, just to make sure your teeth are nice and healthy. In conclusion, that was my thoughts, face the facts on TMJ and masseter Botox. Hope you learned something today, and I'll see you guys next time.